Hello everyone. Today I'm gonna represent our journal club. Our journal club is a peer review paper. The peer review paper is related to social determination of health associated with mental health among US mothers with children aged 0 to 5 years. What is the difference between mental health and mental illness? Mental health is about mental wellness. We all have mental health. Mental illness is when someone is diagnosed with mental disorder. Study objective. The aim of our study of the paper is to examine the social determination of health and their association with poor maternal mental health for mothers with children aged 0 to 5 years in the United States. The name of the journal is Journal of Women's Health. The impact factor was 2.104. The site score was 3.5. The study design. The evidence of the study was level 5 evidence. It was observational, cross-sectional, retrospective study. The study population was mothers it was mothers in the state. It was nationally representative. The sample size was 19,127. Parents fill out the NSCH survey during 2016 to 2017. It was self-reported as the mother used to self-report it. There was no mention about how the consent or the ethical approval was obtained in the paper. What is the social determination does this research identify? This paper identifies that mothers of young children are at increased risk of mental illness as parenting bring new social and financial challenge. Women who are younger, women who are 18 to 25 and unmarried and have poor health and have poor social support and have encountered two stressful events are at greater risk of experiencing mental illness. Mothers with previous traumatic stress exposure are at greater risk for prenatal depression and comorbid post-traumatic stress and anxiety. Women who born in the United States also had a child with mixed race and ethnicity and had a child with special healthcare needs are at greater risk of experiencing stress and anxiety. Also, the household poverty, food insecurity, and social impact index, neighborhood safety. Now we're gonna talk about the inequalities. So, what health inequalities does this this paper identify? We're gonna start with mother with poor mental health are at increased risk of unemployment, and unemployment can lead to low socioeconomic status, reduced financial. This lead to a chain of circumstances and that make women struggle with mental illness, because once the mother reduce her finance and have that make her experience food insecurity, and food insecurity will lead to a greater risk of poor mental health. Food insecurity leads to greater risk of poor physical health, and poor physical health also gonna develop poor mental health. The key results in the study: mother age was one of the key results of the study. We can see here younger mothers have a higher risk as they have 11.3. and mothers who born in the state also have a higher risk. The physical health had the highest significant numbers, and food insecurity also was one of the key results. The social capital, women who have low social capital support have a higher risk of mental illness too. The strength and limitation of the study. One of the strengths was the sample size. The sample size was large for this paper, and limitation was we're gonna start with data was cross-sectional and self-reported, therefore they are unable to determine if these finding was persist over time. Some risk factor of the maternal mental health, such previous trauma exposure, previous mental health challenge, insurance status, and mother race ethnicity are not included in the NSCH, but they are so important, and it should be covered in the future studies. Thank you for your time and hope to see you again.